Pediatric nursing is a special calling. It's a field that requires not just medical knowledge but also a deep sense of compassion and patience. It's about caring for the youngest and most vulnerable patients who often can't express their needs or fears. The NCLEX exam knows this. It tests nurses on their ability to handle pediatric cases with the utmost care and precision. It has a big focus on pediatric care, ensuring that nurses are well prepared to meet the unique challenges of this field. Why? Because nurses need to be ready for anything. Pediatric patients can present with a wide range of conditions, from common colds to critical emergencies. Think about it. Kids aren't just small adults. They have unique needs that require specialized knowledge and skills. Their bodies are still developing. They communicate differently, often through nonverbal cues that nurses must learn to interpret. This impacts everything from how we give them medicine to how we talk to their families. Effective communication is key in pediatric nursing. That's why acing the pediatric portion of the NCLEX is so important. It ensures that nurses are equipped to provide the best care possible. It shows you're ready to handle the challenges and joys of caring for kids from their first breath to their teenage years. From newborns to teenagers, you'll be their advocate, their comforter, and their guide through the healthcare system. Your role is crucial in their journey to health. So let's dive into the key concepts you need to know. Understanding these will help you excel in your career and make a real difference in the lives of young patients. Get ready to unlock your inner pediatric nursing superhero. Your journey to becoming a skilled and compassionate pediatric nurse starts here. One of the most exciting things about kids, they grow like weeds. From the moment they're born, they embark on an incredible journey of growth and development that is both fascinating and complex. But this also makes pediatric nursing complex. Each stage of a child's life comes with its own set of challenges and milestones that healthcare professionals need to be aware of. You need to know what's expected at each stage. This knowledge is crucial for providing the best care and support to both the child and their family. Think about it like this. You wouldn't expect a baby to walk and talk like a 5-year-old, right? Each age has its own unique developmental milestones. For the NCLEX, focus on these milestones. Understanding them can make a significant difference in your assessments and interventions. Infancy, from 0 to 1 year, is a time of rapid growth. Babies grow and change at an astonishing rate during this period. They learn to sit, crawl, and maybe even walk. Language is just starting. They begin to babble and might say their first words. Toddlerhood, from 1 to 3 years, is all about walking, talking, and testing boundaries. They are curious explorers. This is a time of significant physical and cognitive development. Preschool, from 3 to 5 years, is when imagination soars. They engage in pretend play and start to develop social skills. They start to understand more complex language and ideas. Their cognitive abilities expand rapidly during this stage. School age, from 6 to 12 years, is when friends become super important. Peer relationships play a crucial role in their development. They develop self-esteem through school and activities. Achievements and social interactions help shape their self-concept. Adolescence, from 13 to 18 years, is when puberty hits. This stage is marked by significant physical, emotional, and social changes. They're figuring out who they are, dealing with peer pressure, and striving for independence. It's a time of self-discovery and identity formation. Knowing these stages helps you provide age-appropriate care. Tailoring your approach to the child's developmental level can improve outcomes. It also helps you spot potential developmental delays early on. Early detection is crucial for timely intervention. Remember, early intervention is key. By understanding and supporting each stage of development, you can make a lasting impact on a child's health and well-being. Assessing a child is like solving a puzzle. You need to be a detective, looking for clues. But here's the catch. Kids can't always tell you what's wrong. That's why you'll use a combination of observation, physical exam, and communication. Observation: how does the child look? Are they playful or lethargic? What's their body language saying? Physical exam: this includes checking vital signs and knowing the normal ranges for each age group, listening to their heart and lungs and examining their body. Communication: talk to the child at their level and the parents. They are your best source of information. Remember, a child's comfort is key. Start with the least invasive procedures first. Make it fun. Use toys, games, and a gentle touch to build trust. Section 4. Common Pediatric Conditions. A Nurse's Guide. In this section, we will explore some of the most frequently encountered pediatric conditions that every nurse should be familiar with. Ready to play Name That Condition? This interactive approach will help you remember key symptoms and treatments. Don't worry, this isn't a pop quiz. It's a fun way to reinforce your knowledge. But remember, the NCLEX will test your knowledge of common pediatric illnesses. So, let's dive in and make sure you're prepared. Here are a few to focus on. These conditions are not only common but also critical to understand for effective patient care. Respiratory syncytial virus, or RSV, a common respiratory infection that can be serious in infants. It's especially prevalent during the winter months. Watch for coughing, wheezing, and difficulty breathing. Early detection and supportive care are crucial. Asthma. This chronic condition causes inflammation in the airways. It's one of the most common chronic diseases in children. Kids may wheeze, cough, and feel short of breath. Gastroenteritis, stomach flu, anyone? This condition can spread quickly in schools and daycare centers. This leads to vomiting and diarrhea. It's important to manage symptoms and prevent dehydration. Dehydration is a big concern, especially in young children. Ensure they get plenty of fluids. Croup. This viral infection causes a barking cough and difficulty breathing. It's often accompanied by a hoarse voice. It's often worse at night. Humidified air can help ease symptoms. Ear infections, or otitis media, common in infants and toddlers. They can cause significant discomfort and sometimes lead to hearing issues. Watch for ear pain, fever, and irritability. Prompt treatment can prevent complications. The NCLEX wants to know you can recognize these conditions, understand their treatments, and provide the right care. Your knowledge and skills are vital in ensuring the health and well-being of your young patients. Section 5. Safe Medication Administration. Tiny patients, big responsibility. Giving medication to kids is a huge responsibility. Their small bodies process medication differently than adults. Plus, getting a toddler to swallow a pill, that takes serious skill. Here's what you need to remember. Weight-based dosing. Kids' doses are calculated based on their weight, not their age. Precision is key. Double-check your calculations. Different routes. You'll use various routes to give meds, from oral to IV. Know the pros and cons of each and how to administer them safely. Age-appropriate techniques. For oral meds, use syringes for accuracy. Make it fun. Let them squirt the medicine into applesauce. 5 rights every time. Never forget the 5 rights of medication administration. Right patient, right drug, right dose, right route, right time. Remember, safety first. Section 6. Family-centered care, a team effort. In pediatric nursing, the family isn't just visiting, they're part of the care team. They know their child best. Involve them in every step. Here's how to practice family-centered care. Communication is key. Keep families informed. Use clear, simple language they can understand. Active listening. Listen to their concerns and questions. Respect their beliefs and values. Empowerment. Teach families how to care for their child at home. Provide resources and support. Remember, you're not just treating a child, you're caring for a whole family. Build trust, show compassion, and create a supportive environment for everyone. Section 7. NCLEX. Success. You've got this. The NCLEX can feel like a mountain to climb, but you've got this. You're passionate about pediatric nursing. You're learning the essential concepts. Now it's time to believe in yourself. Here are my final tips. Practice makes perfect. Use NCLEX. Practice questions to get familiar with the format. Focus on pediatric-related topics. Study smart. Break down your study material into manageable chunks. Don't try to cram everything in at once. Take care of yourself. Get enough sleep, eat healthy foods, and exercise. You need to be at your best on exam day. Remember, you are capable, you are prepared, and you are going to rock the NCLEX. Go out there and make all us pediatric